All right, thank you, Kate. Well, now time to answer some common health questions. And joining me now is News Channel 5's medical expert, Dr. David Soria. Hello.
Hello, how are you?
I'm doing well.
Good.
Just so you know, when he's not here with us, he is the Chief of Emergency Medicine at Wellington Regional Medical Center. Thank you again for coming in
You're
today.
welcome.
All right, let's dive right in. Our first question. Fluoride gets a bad rep sometimes. A lot of people say it's in the water, it's bad for you. So we're talking about the fluoride toothpaste. What age should your child use it?
Yeah, you're exactly right. It does get a bad rap, but it is our friend, and actually most dentists do recommend it as early as possible because it's a very effective way of fighting cavities in our youth. One problem is this, is that if it's swallowed in excessive amounts, it can cause what's called fluorosis, which is really just spots or permanent staining on the infant's or on the child's developing teeth, which is obviously not one thing that you want, but otherwise it's not poisonous or dangerous to their health. So the American Dental Association says 2 years old for fluoride toothpaste and 6 years old for fluoride rinses. But really, as a general rule, it's much easier than that. You as a parent make the determination as to when your child can completely spit out the toothpaste or the rinse. Once he or she is able to do that, that's the age you want to start doing it. So this way they don't swallow it, give them an upset stomach, and put them at risk for excess fluoride ingestion.
That certainly makes sense there.
It's simple.
All right, well, we're coming up on that time of year where seasonal allergies come up. So what is the best treatment for those seasonal allergies?
Yeah. Well, we're getting hit really hard this year. We've seen a lot more seasonal allergy symptoms early in the year. So most of us know the symptoms, and really 20% of us actually suffer from them. So we know coughing, sneezing, watery, itchy nose, watery, itchy eyes, asthmatic. And one of the most common symptoms that we don't think about is fatigue. That's really unexplained. So really the best treatment is as follows. It's unfortunately symptomatic. You have decongestants, any of the things that can dry up your nose. We have antihistamines. There's the old ones, which are Benadryls, or that type diphenhydramine. And there's your newer generation in Zyrtec and Claritin. If those don't work, then you need to try something a little stronger like a corticosteroid, which comes in a pill. But the most effective to help the nasal itching, watery eyes, itchy eyes is going to be a nasal steroid. Spray it a couple times in each nair twice a day. Typically within 12 to 24 hours you'll see significant relief from those symptoms. And if that doesn't help your eyes, there's also new eye drops that are specific just for eye allergies. I recommend those, very effective, but you need to be ahead of the game.
Right.
Once you start to feel those symptoms, use them early, and that's the best way to get
Look,
rid
we're
of
always
those.
ahead of the game. That's why we listen to you, Dr.
We
Soria.
try to be.
Look, you're a medical expert. That's what you're here
Good.
for.
I'm glad
All
to
right.
hear that.
Now, if you have a question for Dr. Soria so you can be ahead of the game, just send it into our website, WPTV.com. Click on the health link there, then scroll down, and on the right-hand side, that's where you'll see a form to write in your question. Thank you once again for coming in.
You're
We
welcome,
appreciate
Julie.
it. We'll see you next week.